Last session, I'm sure everybody's eager to get the GBM started, so I'll not take too much of your time. Neeta asked me to talk on Medispas, and the only reason I decided to or accepted this talk was to give a new perspective and to open up our thought process of how the future may be shaping up. This talk is not for all those who are successful, established and in their practice. It is for those who are young and starting off with their practice and maybe thinking of some diversification. Okay. Oops. That's the end of it. Sorry. Okay. Right. Aesthetic plastic surgery is the business of helping people look good, and I'm sure all of you will agree with that. And currently for us plastic surgeons, it is mainly a therapeutic service. But the spectrum of services in aesthetic business can extend from preventative and from maintenance treatment to therapeutic services. And should we limit ourselves to only one end of the spectrum by restricting ourselves to only surgery? Observations during my clinical practice in India, which has been reiterated here during this conference by a number of speakers, is that Indians are basically conservative. There is a hesitancy to surgery. There is fear of scars and possibly unsatisfactory outcome, which is the cause for these reservations. Huge reservations in visiting an aesthetic plastic surgeon, and hence non-surgical procedures are preferred by them. There's a huge increase in the numbers of dermatologists practicing as cosmetologists, which tells us something, and we need to learn something from that. There's huge increase in the practice of non-surgical aesthetic physicians and lots of quacks as well. The cosmetologists are now primarily being seen as aesthetic physicians. They offer both non-surgical and surgical treatments, and they will dissuade from surgical treatments most of the time, but will call someone if unavoidable, which is rare, and it is usually somebody who's not as competent as our esteemed members. So what should we be doing to change this scenario? And how can we retain our mastery and primacy in business of helping people look good? We need to introspect and seek a new way forward, because if we only continue with the business of cutting and surgically improving, it will take some time in this country for that psyche to change. Why can't we offer both these services ourselves? I'm sure we can do a better job. And should we be lifelong dependent on our hands working, or can we get others to work for us? We are all surgeons and we love to operate. Nobody's stopping you. But there are times when you may not be able to, and if you're not, then your practice comes to a halt. So we have to look at whether we can change the scenario where we are doing what we enjoy doing, but at the same time there are others working for us, and the wheels don't stop. In 2005, I studied the aesthetic setups in USA, UK and Australia. At that time I found that in USA mostly there were day surgery centers or Medispas. That's how the cosmetic practice was centered. The hospital setup is the third, which does not yield many cosmetic surgery inquiries, and I'm sure a fraction of the people coming to hospital seeking for an improvement is far less in comparison to all those who are probably seeking help outside. So aesthetic day surgery centers are mainly therapeutic, and in the Indian side they would only cater to surgery, and hence attracting free flow of patients would still be a little difficult. So that's where the concept of Medispa came in, and it was a new concept at that time, relatively new now. It's a medical facility with a spa, and it's an integrated center which helps you look good and feel good, and that's what we focus on, that's what we are dedicated to, and that's what is our mantra. Not only that, but we also advocate the concept of wellness. And what is wellness? It's a psychological state in which you are not only looking good, feeling good, but also physically fit and well. So we are expanding the concept, and we are looking at a person holistically and trying to deliver what that person's ultimate goal is. So wellness services can be divided into two broad arms. You can have the preventive and maintenance treatments and the therapeutic treatments. The spa therapies, nutrition, fitness, something like medical micropigmentation, hair, nails, even yoga and meditation all come under preventative and maintenance treatments. While the therapeutic ones are cosmetological treatments, surgical treatments, even bariatric, cosmetic dentistry. So all of these services can be subdivisions or components of your Medispa treatments. What it needs is basically a pleasant, peaceful, calm, serene atmosphere and environment. We treat healthy patients. They are not ill and they are just like you and I, and they like to be in a pleasant environment. They come voluntarily seeking improvement, not because they are compelled by an illness. A good reception is central, and a spa which is basic, not too fancy, but still quite sufficient to deliver various treatments like aromatherapy, reflexology, Thai massages, or Swedish, or Balinese, or Balinese. So various treatments can be delivered, or you can have even hydrotherapy, a jacuzzi which gives you floral oil soaked treatments, or veniotherapy for skin's improvement, for detoxification of the skin, a Vichy shower to wash down the scrubs and exfoliate. And on the other end, you can have a full-fledged operating theatre as well. So both of these things can be under one roof, and you would need consulting rooms and treatment rooms, and that's it. Treatments in the spa section are usually given by therapists. You can have a spa manager to look after them. And we aim at skin exfoliation, toning and conditioning to maintain the health of the skin. De-stress by various massages, unwind, unknot the strained and tauten muscles, moisturizing, hydrating and polishing, and all of that gives a sense of wellness. Or you may not have that section and just stick to medicated facials. You can have treatments for pigmentation, skin glow, or even acne being offered through the facial treatments, or hair treatments for hair spa. So all of these things are kind of low end, but that would still help you classify yourself as a medical spa. Cosmetology section should have at least a laser hair reduction device, and that is becoming more and more popular, is fairly effective, and that's the bare minimum. Skin rejuvenation, you could have a fractional laser, RBMIAG or CO2, a pigmentation correcting device with the Q-switch NDIAG laser. Skin tightening devices are now becoming popular. That's another thing that you may want to have. A monopolar, bipolar, even a tripolar radiofrequency device. These help in facial skin tightening or even body skin tightening, and they do show an improvement in if you select the cases properly. The other treatments are cosmetology would be your chemical peels, botulinum toxin, fillers, PRP, other treatments for hair loss like laser therapy, laser combs and laser helmets and things like that. A lot of these were discussed today. But a new frontier that we need to look at is the anti-aging science, and this is catching up in a big way in US, and it focuses on optimization of your micronutrient levels and hormones to help you deliver your optimum potential. You can pick up signs of patients who are not necessarily ill, but on the border, like hair loss happening due to micronutrient deficiencies, or sallowness of the skin, or darkening of the dark circles, and number of things like that. So these can be optimized by checking the micronutrient levels and hormones, and this is a new science that is being done mostly by the physicians and the cosmetologists in US, but I'm sure we should be able to handle that side as well. And then cosmetic surgery, which is body and face rejuvenation and body and face reshaping. So I'm not going to talk much on this because all of you are fairly aware of that section of the Medispa treatments that we can offer. So we need to look beyond surgery. There's a huge scope for development of non-surgical options in aesthetic medicine. Offering everything makes you a more complete aesthetic physician. You can offer everything under the umbrella. If you have only if you have only a hammer, then you would hit you think everything is a nail. So it's not like that. You can then properly customize the treatment to what the need of the patient is, and you can channel either into non-surgical or cosmetological treatment or surgical treatment as per the indication, and you would be able to give a more satisfied patient. And you have to think about corporatization of your practice, as it helps you become less dependent on your own hands, and you can get other people to work for you. Lots of therapists and good quality assistants are there to help you. So all of this needs to be looked at as a future for those who are young and who are branching out and thinking of what to do. This is also an option that you should think about. At the end, I would like to announce the applications are invited for the Maharashtra Institute of Health Sciences Recognized Fellowship in Aesthetic Plastic Surgery. This is at Aesthetics Medispa. It's a 1-year course. Last date for application is the 10th of May, and you can download the forms from aestheticsmedispa.in. Thank you.